Today, we will hear from Pakistan, Senegal, and Thailand, but also invite others joining us in the audience to share your experiences during the Q&A or in the chat box. We hope that from this webinar, participants will leave with an understanding of the Pandemic Fund and learn from countries actively working on their proposals, their approaches, challenges, and successes, which can support other countries also on this journey and inform those working to ensure the Pandemic Fund lives up to its promise. We thank the Advocacy and Communications Task Force for their support in organizing the event. We thank the Pandemic Fund Secretariat and all of our speakers for joining us to share their experiences, as well as our moderator. I will now invite Priya to kick us off on the Pandemic Fund and what countries need to know about the first call for proposals. For a brief introduction. Prior to her current role as Executive Head of the Pandemic Fund Secretariat, Priya served as head of the COVID-19 Task Force at the World Bank and led the bank's engagement on pandemic prevention, preparedness, and response in global fora, including the G20 and G7, coordinating across finance and health. In previous roles, she managed a $21 billion portfolio of financial intermediary funds and trust funds administered by the bank to support global priorities such as financial inclusion, global health security, climate change, and debt relief. I will now turn it over to Priya Basu. Thank you.
Thank you so much, Ilya, and thank you, colleagues. It's a pleasure to join you today. Good morning, good afternoon, good evening, wherever you are, to present to you a brief update on the Pandemic Fund. And I should just say that I'm joined by my colleagues from the Pandemic Fund Secretariat, Frank Berth and Anita Rosowska. I'm going to have to hop off in about 15 minutes, so I will hand over to Frank Berth after my presentation. So we have a few slides here. You can please turn to the next one. And the next one, please. So as Ilya mentioned, the Pandemic Fund was established last year, towards the end of last year. It comes out of lessons learned from the COVID-19 crisis that showed just how ill-prepared the world was to deal with the pandemic of that scale, and just how weak capacities were in pandemic prevention and preparedness and response, particularly in low and middle income countries. Together with the World Health Organization, we prepared a study last year in March of 2022 that estimated that about $31.1 billion of additional financing is needed per year over the next 5 years to strengthen the capacity of low and middle income countries in PPR. And that 2/3 of this would need to come from domestic financing and about 1/3 from external financing. And so under the leadership of the Indonesian G20 presidency, but also with leadership that had already begun under the Italian presidency, and with strong support and a championship of the United States, the Pandemic Fund was rapidly established. Actually, it was less than a year ago when the G20 formally asked the World Bank to start exploring a new financing mechanism. And we're proud to say that, working with our G20 partners, with the WHO and others, we already have the Pandemic Fund now up and running. It was formally established last September, presented to the G20 in November, and last month we issued the first call for proposals. Next slide, please. So as Ilya already mentioned, the Pandemic Fund's mission is to provide a dedicated stream of additional long-term grant financing to low and middle income countries to support critical pandemic PPR functions. Eligible countries are what we call IDA and IBRD countries. Those are the 144 countries that are eligible to receive financing from the World Bank's International Development Association and IBRD. So these are the eligible countries, and the Pandemic Fund seeks to support and reinforce capacity building and implementation on pandemic PPR under the International Health Regulations 2005 and other internationally endorsed legal frameworks consistent with the One Health approach. Key value additions: it mobilizes additional funding, including from non-ODA sources. It seeks to promote coordination amongst key agencies engaged in PPR and serves as an integrator. It complements domestic PPR investments as well as financing provided by international institutions, and it serves as a platform for advocacy. In terms of its design features, it has the flexibility to work through a range of existing institutions that include multilateral development banks, the WHO, UN agencies, etc. So it really is not a new institution that makes direct investments in pandemic PPR, but rather channels funding through existing institutions that we call our implementing entities. And every dollar of financing that the Pandemic Fund will provide seeks to incentivize efforts by countries themselves and catalyze financing from multiple sources at the project level. Next slide, please. So very briefly, in terms of its governance, its governance is grounded in the spirit of shared responsibilities needed to address global public goods. The Pandemic Fund is governed by a board that is chaired by Dr. Khatib Basri, who is the former finance minister of Indonesia, and the board comprises 21 constituency-based voting seats representing sovereign contributors, 9 seats for the 22 sovereign contributors that have contributed funding to the Pandemic Fund, 9 seats for the sovereign co-investors. Co-investors are the countries that are eligible to receive funding from the Pandemic Fund. And as you can see here, there are 9 seats. The one for Southeast Asia is currently represented by Bangladesh. EMRO, which is the Middle East and Central Asia region, is represented by Pakistan, and so on. And then we have 1 seat for our 3 philanthropies, and then 2 seats for civil society organizations who are also voting members of the Pandemic Fund's board. The board of the Pandemic Fund is scheduled to undergo a reset in May 2023, next month, where sovereign contributors will be the voting seats allocated to them will be reset based on the contributions that have been made since September of last year. The initial allocation of seats was based on contributions up until pledges up until September of last year. Now the board will reflect contributions in the form of signed contribution agreements. The sovereign co-investor seats will also be reorganized based on a self-organization process that's currently underway, as will the seats for CSOs. Next slide, please. So we launched our first call for proposals in March, on the 3rd of March last year. 3rd of March this year. And just to say that so far, the Pandemic Fund has mobilized $1.6 billion of financing. But we decided that the board of the Pandemic Fund decided that the first call for proposals would be about roughly 300 million. It could increase slightly, but this is going to be a pilot call from which the Pandemic Fund hopes to learn. So the first call for proposals that was announced on the 3rd of March has 3 focus areas: disease surveillance, national laboratory system strengthening, and building human resources capacity for PPR. The approach that the first call for proposals has taken is inclusive and country-driven. We can accept single country, multi-country, and regional proposals. In keeping with the design of the Pandemic Fund, all funds will be channeled to beneficiaries through implementing entities. Some of the key principles of the first call for proposals, which are in line with also the principles of the Pandemic Fund itself, that country proposals will need to demonstrate strong beneficiary ownership and grounding in national action plans for health security. And if they're regional proposals, they will need to be grounded in regional plans. The proposals will need to demonstrate co-financing from the implementing entities, and co-investment from beneficiaries if the fiscal situation of those beneficiary countries allows for financial co-investment, and coupled with strong policy commitments to PPR from all countries that are seeking pandemic fund resources. Next slide, please. So how to build a proposal, who can apply? One or more of the eligible countries that are interested in applying for pandemic fund resources can submit a proposal, or regional entities as defined here, which are specialized technical institutions established by the governments of one or more eligible countries. And they have to join together with one or more of the 13 implementing entities that are listed here on the right side of the slide. Next, please. The proposals need to be aligned with the Pandemic Fund's results framework, which is also posted on our website alongside with all of the information on the call for proposals. And the results framework has these 4 core dimensions. I think we're joined here by Mike Mahar from CDC and his team, with whom the Pandemic Fund worked very closely to develop the results framework. Next slide, please. And as I mentioned already, the Pandemic Fund, since it seeks to catalyze additional funding for every dollar of grant resources that it provides, it places a strong emphasis on both co-financing and co-investment. Co-financing is what those implementing entities can bring to the table for every project that the Pandemic Fund supports. I should note that the multilateral development banks and the specialized Geneva-based health agencies that are implementing entities are required to provide financial co-financing. The UN agencies, if they serve as implementing entities, that is, if the WHO, UNICEF, or FAO serve as implementing entities, then they are required to bring in-kind contributions and technical assistance, given that they are not financial institutions. And then every proposal needs to also demonstrate co-investment. And here we make a distinction between countries that are in debt distress or at high risk of being in debt distress and countries that are not in debt distress. And so if you're a country that is in debt distress, then you are required to provide co-investment in the form of policy commitments. And if you're a country that's not in debt distress, then you're required to bring co-investment in the form of financial investments, and of course also strong policy commitments towards pandemic prevention, preparedness, and response. Next slide, please. Every proposal that will be submitted to the Pandemic Fund for financing will be evaluated by the technical advisory panel of the Pandemic Fund. This technical advisory panel is a panel of 20 members chaired by Mike Ryan from the WHO, and the vice chair is Joy St. John, who is the head of the Caribbean Public Health Agency. And the panel includes 20 leading experts who were selected through an open competitive process. And I should say more than 300 experts actually applied and 20 were selected. The technical advisory panel will evaluate technical soundness of each proposal and make recommendations to the Pandemic Fund's governing board. And then the governing board will decide on the final allocation of resources. And each proposal will need to be submitted through a web-based application platform. Right now on our website, we have all the details of the call for proposals, but the web-based application platform is not yet live. It will be live in early May. Next slide, please. So I just want to share with you that in preparation for the first call for proposals, the Pandemic Fund Secretariat issued an expression of interest process in February. This was not mandatory. This was just to give us a sense of what the demand was. And I wanted to share that we've received 647 expressions of interest from over 100 from over 100 eligible countries, amounting to grant requests of 7 billion. 73% of the eligible applications are single country proposals, and the rest are multi-country or from regional entities. And most of them focus on at least 2 of the 3 priority areas. 46% of the proposals submitted through expression of interest process are from sub-Saharan Africa, and 60% of the funding requested, the 60% of the 7 billion in funding requests are also from Africa. And just one broad point that's come out of this expression of interest process is the tremendous demand. Very encouraging to see countries so seriously engaged in PPR and interested in support from the Pandemic Fund to strengthen their capacity for pandemic prevention, preparedness, and response. Next slide, please. So what's next? As I mentioned, the board will be reset in May of 2023. The first call for proposals is currently active. The web interface will become live on the 1st of May. The call for proposals closes on May 19th. The evaluation of the proposals will happen during May and June. First level of screening by the Secretariat, and then evaluation by the technical advisory panel, which will then make its recommendations to the governing board of the Pandemic Fund, which expects to be able to make its final allocation for proposals in July of 2023. Next slide, please. So this is where you would find details on the Pandemic Fund website. We have here all of the governance documents of the Pandemic Fund, the results framework, the details on the call for proposals, the process, the template, and so on. So we would strongly urge you to have a look at our website. And of course, me and the Secretariat team, we're available to answer your questions by email anytime. Thank you very much for your attention, and back to the chair.
Thank you so very much for the presentation. Could we please impose upon you for one moment? I think we have one very good question in the chat box that it would be wonderful to be able to ask now as we go into our panel discussion. One of our participants has asked, given that countries have the concurrent opportunities to submit proposals for the Pandemic Fund and Global Fund C19 RM Wave 2 and RSSHPP, and understanding that funding is not guaranteed through these mechanisms, how would the Pandemic Fund colleagues recommend that countries proceed? If countries want to ensure support of essential elements of their national preparedness, should they include certain elements in all of those proposals?
So that's an excellent question. And as we speak, the Pandemic Fund Secretariat has been running a number of webinars to also provide guidance, and this question has come up there too. And concurrently, the implementing entities, the 13 implementing entities of the Pandemic Fund, have also been working together to align and help countries coordinate. So one big point I want to make is that we are encouraging the Global Fund and the other implementing entities of the Pandemic Fund to really work together with countries, so that when a proposal is submitted, it reflects support from these various implementing entities towards the National Action Plan of the country. So we would really encourage any country that is interested in applying for funds from Global Fund through the C19 RM process, and also interested in applying for funds from the Pandemic Fund, and also working with say the World Bank or the Asian Development Bank or any of the other implementing entities or Gavi, to please reach out so that we can help promote coordination amongst those various implementing entities to support the country and provide you with guidance on how to go about this, because we really don't want overlapping proposals. We would like proposals that are connected and coordinated. And Frank can, during the Q&A part, Frank can provide more details on this, because he has been very actively involved in this process of promoting coordination and guiding countries on how to apply for financing in a manner that is more connected.
Thank you so very much for taking the time to address that question and for your presentation. We very much appreciate the insights and your time. And I will, again, let the participants know that there will be representatives from the Pandemic Fund who will participate in the Q&A period, and we will be moving through the additional questions that are being added in that time.
Thank you so much. Bye.
Thank you very much. We will now be moving to the second presentation in this webinar today. The next part of our event will be a roundtable to highlight country experiences in developing pandemic fund proposals. I would like to introduce our moderator, Dr. Mukesh Chawla of the World Bank. Dr. Chawla is currently the Chief Advisor for Health Security at the World Bank and coordinator of the Pandemic Emergency Financing Facility. He's worked for over 20 years with governments and international development partners in Europe, Asia, and Africa on a variety of health sector issues, and is currently focused on helping countries prepare to respond immediately and effectively to disease outbreaks of pandemic potential. His experience includes being an instrumental part of the launch of the Sustainable Financing for Preparedness Action Package in 2019. And I'd like to both thank him for the work that helped catalyze the launch of the action package that is hosting today's event, and turn it over to Mukesh to introduce the panelists and begin the next session. Thank you.
Thank you. Thanks a lot, Jolie. And thank you, Priya, if you're still on the line, for an excellent, exhaustive, very, very clear presentation. It's my pleasure here today to moderate the first roundtable, which is on country experiences in developing pandemic fund proposals. And I have an extraordinary panel. It's going to be a challenge to get everybody to speak in the next maybe 10-15 minutes because we are running a little bit behind time. So in alphabetical order by first name to introduce my panelists, I have the pleasure of introducing Dr. Amer Ikram. And Dr. Ikram is currently the Executive Director of the National Institute of Health in Pakistan, the Director of the Pakistan Field Epidemiology and Laboratory Training Program, and a board member of the Gavi Vaccine Alliance. And Dr. Ikram will be assisted by his colleagues who will be joining him today as well. Dr. Muhammad Salman, Dr. Mumtaz Ali Khan, Mr. Majid Tahir. I have seen at least two of the three online. I'm hoping that Majid is there as well. From Senegal, I have Dr. Ajay Ratu. Dr. Ajay Ratu is the Permanent Secretary of the High Council on One Health in Senegal. And it is our pleasure that Dr. Ajay Ratu is able to join us. And from Thailand, Dr. Swawapak Hinjoy. She is the National Coordinator of the ASEAN Health Cluster 2 and the Chief of Thailand GHSA Coordinating Unit, developing public health control and prevention strategies with the perspective of global health security. So welcome to all of you, and I'm going to go straight into asking some questions, and then hopefully we'll have some time for the audience. I note that we have over 120 members here. So folks, if you have any questions, please post them on chat. We shall keep monitoring them. We shall try to get to all of them, some of them. If you are unable to today, we shall most certainly follow up with you separately later on. So again, following this time on the alphabetical order, but reverse. So starting with Dr. Swawapak. What has been the process, Dr. Swawapak, in your country in collaborating with various stakeholders, because that is something that you are responsible for? What have been the big challenges there? And are there any surprises that you would like to share with us? Dr. Swawapak, over to you.
Thank you very much, Dr. Marquez. And from in the our experiences, when we said that in the we would like to apply for in the pandemic fund, the keywords is been that in the multi-sectoral approach, and in Thailand we have the big committee that we call in the National Committee for International Health Regulation. Under in this infrastructure, we have in the different ministry that in the under this committee. The problem that in the National Committee of IHR is kind of like in the very formal organization, very formal committee. So that's mean we need to have like a agenda and then the have like a formal invitation letter. Finally, this kind of the process, even the anything like happen, just like a urgent issue, maybe it's hard to lead to in the National Committee of the IHR. So we need to like approach in the term of the informal. Because in the dealing in the when we work or have a meeting among the committee of the national IHR, we also have kind of like a working group or in the small task that in the we can talk among each other. So that's mean when in the we know about in the call for in the proposal of the EOI, the pandemic fund, we use informal network of in the national of in the IHR. That's we can collect in the like their our like a friend on the network from in there because I'm from Ministry of Public Health, but in the IHR we also have like a Ministry of Agriculture and Cooperatives. We have like a Ministry of Natural Resource and also from in the Academic Institute. So their informal network under the formal National Committee of IHR is really like active. And that's been why we can like pool like a knowledge and the thought among each other to form like a EOI. So this is the way that in the how Thailand move forward in the term of in the submit of in the EOI and the proposal.
Excellent,
okay, thank you.
excellent. Challenging indeed. Dr. Ajaratu, a question for you. How are you deciding on who to partner with as an implementing entity as you start planning your proposal?
Thank you very much, Mukesh. Thank you very much. As the first time, I wanted to tell thank you very much for this invitation. I think it is very, very important for the Senegalese team. I am connected with a lot of members of writing proposal. And you know, my English is so bad. I want to give the floor to Dr. Nyo. And after Dr. Sheikh, you answer the answer of Senegal.
Your English is perfect, madam. I wish I could speak with you in French, and then you'll be horrified.
I give the floor to Dr. Nyo, and
okay.
Thank you.
Thank you, Dr. Ajaratu. And allow me to answer on her behalf. Like you say, in the implementing entity, as we are talking now in Senegal, we are in a retreat for writing our full proposal. And even we get out from that retreat to have this meeting to show you how far we are in the process. And in Senegal, what we did is we have the One Health platform, which is under the Premier Minister's office, which gathers all the different key ministry, but also they invite all the partners in the country to map out all the different interventions to make sure we have complementarity and to make sure we don't have duplication. And I think they put the choosing of the implementing entity at the end. The way we did the proposal is just we write the full proposal, map out all the stakeholders, and map out all the implementing entity, what co-financing, what additional input they put in this proposal, and after they will decide how to go by. Is the process they have in place in Senegal. Over. Thank you very much for the invitation.
We can't hear you. Dr. Ajarathu, we can't hear your colleagues.
Okay, I think it is okay. Possible to have the second question from Senegal, or we must waiting.
Okay, we seem to be having some technical issues there. I will come back to you, Dr. Ajarathu, in a second. Let me turn to Dr. Ikram with a difficult question, which I especially reserved for you here, Dr. Ikram. How do you prioritize? How do you decide which activity to finance and which one not to finance? There are so many important things, and I'm sure that everybody must be telling you that everything is important, but then the resources that we have are limited. So how do you decide what to finance? Dr. Ikram.
Thank you so much. First of all, it's a privilege, and thank you so much for organizing this platform, because I think coming almost out of the COVID crisis, I think it has become a bit easier. You talk in terms of in the context of learning and lessons coming out of the COVID crisis. I think the huge crisis the whole globe has faced. And in particular, the LMICs, we in LMICs has a lot of learning. And we truly know what are the gaps, where are the gaps, and how to basically fill those gaps. And before that, not forgetting the joint external evaluation in 2016. And now as we move towards the joint external, next phase of the joint external evaluation with a new tool, and in particular, its correlation with the IHR and all that, we definitely, with the pre-assessments and all that, are in a shape where we can prioritize. And already the World Bank has highlighted 3 areas, the human resource development, the lab and diagnostics, and the surveillance. So out of the context, we truly know where we are standing at the present stage after undergoing the crises, and that made it much more easier. And one more thing, that all things are coinciding just at the one time. You talk of the Pandemic Fund coming at the appropriate time, talking of the Pandemic Treaty coming through the WHO, and so many other things. So it's been an easier with all these assessments and actual on-ground experience, making it much more comfortable in deciding which are the areas, though definitely there are far beyond these 3 domains which are being discussed right now. But I would also like the one thing also that Pakistan as chairs the GHSA steering group now, to the responsibility of taking everyone along also rests on our shoulder, being a low middle income country. And I think this finance being the main important, and it's a great opportunity that World Bank has floated. I would like Dr. Salman, who is one of the chiefs, to add to it if he has additional points to it, please.
Thank you very much. Well, I think it's based on what we have learned over the years, and especially Pakistan joint evaluation in 2016, we were actually focusing on health security since 2016 onwards, although we were due to international health regulations. But actually, as many countries across the globe, they were tested especially during the COVID pandemic, about their health systems and preparedness for health security. I think we feel that most of the countries have challenges to be prepared for such kind of pandemics and public health events. We actually, based on our experience, I think we definitely feel that financing and pandemic preparedness were actually the key areas. And when we talk of pandemic preparedness, I think these 3 areas, that is surveillance, integrated surveillance, laboratory systems, and workforce development, although all the other areas they were very critical, like risk communication and points of entries and infection prevention. Many areas were critical, But I think these three areas are the pillars of public health system, and need to be the capacity need to be enhanced in low and middle income countries, especially. And if we see in Pakistan, although we have some domestic funding available for these areas based on our previous work, I think that is not sufficient, and we definitely need to capitalize on what is being offered through the Pandemic Fund. Thank you.
Thank you. Let me come back to you, Dr. Ikram, with a follow-up question, and I'm going to pose the same question also to Senegal. So Dr. Ajaratu, the same question will come to you in just 1 second after. So Dr. Ikram, one of the challenges that we see in preparedness financing is sustaining these costs over time. You're hiring a large number of people for surveillance, or for labs and diagnostics, and for risk communication. Everybody is very useful during a crisis time. During non-crisis times, it becomes a bit of a challenge in paying their salaries and sustaining their offices. Is this a problem that Pakistan has experienced? And if so, what is your proposed solution as you move forward with this, given that, I just went through your national health accounts to see how much Pakistan is spending on health, and you have those numbers yourself. So those are the big challenges. So some ideas and some thoughts for us as you move forward on this, Dr. Ikram.
Yeah, that's definitely an excellent question. I must say that I think the problem with the LMICs is definitely talking in terms of launching a project, the donor, the funders, partner, they do join in. What my experience definitely coming at National Institute of Health for the last 6 years has been the best way is to prepare a proposal and a model, and then see where the institute and the government can chip in, and where the other partners like WHO, World Bank, USA, CDC, and all others, where they can join. The other aspect is, once we have multi-donor operated projects, you may go into duplicacy. So one has to avoid that duplicacy as well. And this has been success in Pakistan, that just talking you about one great example about the integrated disease surveillance and response, where we had one partner which started the working, then another donor also joined, but we made it successful after piloting in one of the main provinces, then at the federal level, and then taking it to the other province, and then taking it back to the government, because the sustenance is the job of the government. And that is how we could procure 4 billion Pak rupees for integrated disease surveillance and response system within the country. So the sustenance is definitely the job of the government, and it's the institution which has to be very, I would say, advocative. And the communication has with the hierarchy definitely is to the best possible level in order to get the things from the governmental side. The second thing is, as we moved on for the antimicrobial resistance, we had multiple partners, but after went to the government side, and we are sustaining. Now, coming back to this grant in particular, definitely there is a huge cash that we can pick up. A good number of human resource, we can train them. But again, retaining them is the actual success for the country, for the institute, as well as for the World Bank. And that's what we would be looking forward in this grant as well, that we get the people, train them, and once they are working, the future sustenance should come from the government side, as we have done. And I've just given you 2 examples. There are multiple examples now where NIH has been successful in getting the governmental grants in this regard. We would like to adopt the same model without any duplication or triplication of efforts, and definitely making the funds coming from the World Bank much more meaningful as much as possible.
Thank you. Thank you very much. I see Dr. Salman's hand raised, but please bear with me. I need to get to Senegal first very quickly. Dr. Ajaratu, same question. Sustaining these finances, particularly the recurrent expenses, huge challenge. IDSR, I know, has been a big success, including in Senegal. But as you move forward, what are your thoughts on the challenges of sustaining the recurrent cost? Over to you.
Thank you.
Thank you very much. I think in Senegal, we have high commitment of the government. Even the way the National One Health platform is put is under the Premier Minister office with the decree instituting this One Health platform, which coordinating all the activity. Even like I said earlier, we are here with Dr. Ajaratu, which is the Secretary Permanent of One Health, but also we have the civil society. When we have different people from the full proposal, we are writing now at the retreat we have. And the National One Health platform already lay out the work in the ground with the institution of the government. Like most people involved in this response are government hiring people. And also we have a lot of capacity building with the different program, FETP, ISAVET, good emergency management practices we have at country level. Even we have some program at country, whereas the institution, they hire people for the duration of the project, and the government have commitment to hire those people permanently after the phase out of the project. And I think I will hand out to my colleague, Shahnya, which is member of the civil society, which can lay ground what we're doing at country level for sustainability. Over.
Thank you very much.
We are again not being able to hear you, sir.
Hello. Yes. Okay. Do you hear me now?
Yes.
Yes. Okay. I am sociologist, social anthropologist, and representing the community voices and the civil society voices in this process. To answer to your questions, I put it in a philosophical framework. As the ultimate goal here is how to make the society resilient. It's the issue of resilience. Once this response get into a process of reinforcing, of putting more strength to the resilience of the society. And for that, we need to have the capacity, the capacity building that go throughout the process. Once you master the knowledge, you can apply it in a different situation, not only in the outbreak of the disease, but as you follow, as you control, as you invest in the surveillance of the disease and the emerging and re-emerging disease, you put the need of sustainability. Sustainability comes because people are used to work permanently in different issues, and the government will put the effort on that. Not only the government, but the society itself. The society itself, the culture itself, the women themselves, the social organizations, this large array of social organizations who have been developing experiences, who have learned the lessons from different pandemics that Senegal have experienced. Who this social intelligence that is in the community will be strengthened by this project and will be put in a framework of sustainability. So this is why we don't wear, we are not, we don't have a, we are pretty confident that we are starting a new process that will take a long time. And another thing is that this capacity of doing multitask and adapting the response at new challenges that will come again is filled by the interdisciplinary approach that have been involved, that have been put in the process since the beginning. So the process developed interdisciplinary approach. This is why the universities put social sciences, biomedical sciences, economic sciences all together in this process. And the interdisciplinary approach is highly interactive, and it's connected also to social life and community life. Every time we are connecting, we connect with communities to validate and to consolidate or to inform the propositions that we are working on right now. These are some of the responses we develop from a social science point of view and a community and woman point of view also, because when we talk about community, we see the face of women. It's the women who have been at the front line, and the women who have the more vulnerable because they are at the front line. How we connect the voices of women will be the key for sustainability. This is from a sociological and philosophical point of view.
Excellent, excellent. Thank you very much. Dr. Sowapak, last question for you, and thank you for your patience. Private sector, how do you engage the private sector in all of this? What is the role of the private sector in preparedness? What is your experience of your country? So give us some thoughts on that.
Okay, thank you very much. For India, it's very challenging when we say that in the how we can involve in the private sector into in the work together within the governmental sector. Because in the when building in the my first response, I said that about in the national committee of in the IHR. That means or the total of the committee, it does involve within the governmental sector. And this is a big gap that in the how we can involve the private sector. But in Thailand, we have we use a lot of in the tool that to access what in the prioritization. And from in the last year, we have been piloted up in the universal health preparedness UHPR response, universal health preparedness and response. And also we focus on the COVID-19 response. And we see that one of in the recommendation that in the external reviewer and also from in deep dive from in the our local people in Thailand, we said as in the private sector need to do more and work within the governmental sector. So from in that assessment, we also try to on the some health issue. It does not only for in the infectious disease. For example, a PM2.5 or 2.5 is kind of the climate the problem right now in Thailand about in the a dust or in the PM2.5. We also have a committee and also the meeting that invite the factory and also for in the agricultural production to join within the our a committee and try to find what in the solution that how private sector can work within the government and think about in the solution. And it means that when we say that a private sector, we have to think about a profit as well. That means this is a profit. This is one issue that we have to negotiate within the private sector. So in the key point that how we can balance and how we can engage the private sector to understand if they invest something, that means they can get something, gain something in their business as well. For example, like a COVID-19, because in Thailand, we most often there our budget the money income. This is from in the business part. So that means we can see a lot of the private sector, for example, like a hotel or in the a tour agency that work well within the governmental sector because they want to recover their business. They want to make the country free from COVID-19 as soon as possible. So that means when we promote a COVID-19 vaccine, we get a lot of engagement from the private sector. That means they try to make a campaign, they try to make the announce of the good thing or the benefit of the COVID-19 vaccine. I think this kind of the question for the government and the private that they need to talk and see what the balance between the profit, and also we can get like a win-win situation for our people and so their business. Okay, that is the issue that I think in the foreign pandemic fund, it should be the same thing, that we need to talk this issue with the private sector. Thank you.
Lovely, lovely. Thanks a lot. This is indeed a big challenge. We find that in response activities, the private sector is much more forthcoming. For preparedness, as you rightly noted. We are running out of time. I know that there are some questions in the chat, but probably will not be able to get to that. But before I close, I would like to ask all of our panelists in 1 minute, one final thought of final experience, final lesson that you would wish to share. Since I have you, here, Dr. Sowapak, so let's start with you. 1 minute only, please. A final thought that you would like to share with us on this.
Okay, thank you. The important thing for even though we would like to make like the full proposal for the pandemic fund, or to know what is the important things in the country that to prepare for the response for any health threats. The assessment is important too. Okay, we know that like IHRJE, we have like some tool that we call interaction review. We have the tool UHPR, we have the tool like a PVS. So that means we have to collect on the report, on the result that we discover from that tool, and see the prioritization, and talk within the after stakeholder. It can be like the existing mechanism, for example, like a national IHR committee or in the national One Health committee. So and see that what in the what in the gap, because I know it is maybe kind of like in the nature of in the governmental sector, when we propose for the budget, we think about in the vertical program. So that means we need to talk like in the other sector and see what in the budget that is organization already proposed for to the cabinet, and what the thing is the gap. I think this is important issue. Thank you.
Excellent, excellent. Thanks a lot. Dr. Ajay Ratu, 1 minute, please, only. A final thought to share with all of us.
Thank you very much. I give the floor to Dr. Charnyo.
Okay. Yeah, one strike us now is the proposal will fit into the context of Sahelian countries. And Senegal is known to be a very stable and peaceful nation. But right now, there are a lot of growth of instability around the country, around Senegal. And as there is a link between instability or violence and health status, helping to respond to pandemic is a way to reinforce peace in the whole region. So there is a lot of enthusiasm of the project and the workers in the project and the sector, because there is some hope that Senegal will reverse the image of Africa being unstable, and Africa is being under threat of terrorism and all these political issues. Senegal is raising a lot of hope, and we are fighting for that. And here, there is another thing that strikes us is the spirit of fighting. People are fighting. They are ready to fight. They believe that when there is no fatality, and if we have this means, it will help us to maintain this spirit. And when we don't have this spirit, no matter how good is your program, you will encounter difficulties. Responses are not only technical, they are also emotional, they are social, they are cultural, and we are putting the two sides together. The highly level technical and scientific approach with communities, with culture, with youth, with vulnerability. And there is the issue of trust also. Epidemic are also pandemic of lack of trust, of panicking and all these issues around trust and communication. We are putting them together. We are putting together how trust is regenerated by this process we are putting together. This is why we are very confident. I am struck by how the level of confidence that the group is developing and maintaining, and we hope that it will make the big difference in Africa, and a big difference, and Africa will draw new lessons that the whole world will benefit of.
Thank you very much. Very inspirational. Dr. Ikram, last word to you. 1 minute only, please.
Thank you so much. Coming out of a great crisis, I think I truly believe we have learned as global health is a big challenge, and we all have to join hands together to make it a much safer and a healthier world. And definitely any opportunity that comes at the global level, it's a combined opportunity. We have to be truly dedicated, passionate, honest, and transparent in making it a successful, not only for the country, but for the region and for the globe. And that will be a great success globally. Thank you.
Thank you. Thank you very much. I wish we had more time. This is such an interesting and a very useful, very timely discussion. But unfortunately, the clock is telling me that we are way over already. We will come back to questions in the chat later on. But for the moment, it's my pleasure to thank all of you, to thank all of the panelists, Dr. Ajaratu, you and your colleagues, Dr. Sovapak, Dr. Ikram, Dr. Salman, and your colleagues. And so thank you very, very much. And without much ado, I would like to move on to the second session of the roundtable, which also I have the privilege of moderating. So Dr. Ikram, please stay. You are here. I would like to invite Dr. Meher, Mike Meher, Priya, if it's you or Frank, please let us know who will be joining us, and then we can start. Priya, Frank.
Mukesh, I think it will be me. I think that's
excellent. Frank, it's my pleasure to invite you, and extremely happy. And just want to thank all of our colleagues from the previous panel. So let's start. What the question here that we are trying to ask ourselves, and I'm actually going to start with Dr. Ikram because of Pakistan's position in GHSA this time around. The question is about the GHSA and the Pandemic Fund, and a question for you, Dr. Ikram, in incentivizing additional investments in pandemic PPR, which is, the goal of the Pandemic Fund and so on and so forth. How do you see the dialogue and coordination among the different stakeholders, and what is it that GHSA can do about that? Dr. Ikram, over to you. I can't hear you. You are muted.
Thank you so much. I think GHSA can do a lot. We talk of global health security, and there comes the GHSA. And in turn, its role definitely expand much beyond what it's doing right now, talking in particular of the steering group and all the countries. And if you see the action packages in relation to IHR, International Health Regulations, they're quite an overlapping things. And as I said earlier, the new round of joint external evaluation has also started, and different countries would shortly be going to the next round with the new tool under the IHR. Now, once we integrate all these things, I think coming out of the COVID, we have a huge experience already. And I'm sure that will add to the experience of the countries, to the joint external evaluation, to the global health security in general, and IHR as well. Now, combining all these three things, I would say the communication, which is the most important, and in the modern day, there's no dearth of modalities that are available. And I'm grateful to GHS again for making this arrangement, because this is one of the platforms, now talking in particular about the Pandemic Fund grant, and we've got a huge number of audience now coming in. And the second thing is, we've already heard the statistics, how many EYs were there and how many have been accepted. And definitely it adds to those countries where the initial EYs were not accepted, so they can modify, they can learn from the experience and expertise of the people that are available over there. So this is just one platform, but there could be many more platforms that can evolve through the Global Health Security and Secretariat and onwards, especially talking of, we have a sustainable financing group, which talks a lot. We have been talking a lot for years and years now. And I think this is the best time for them to come forward and to basically help out those countries which have not been successful in the first round, because there's going to be a huge round later on as well, with add up of definitely areas. Right now we have 3, but we are sure that we'll be going beyond that as well. So I think it's all helping and taking along everyone. That's the modus operandi in my mind. That's the modus operandi we need to adopt, that we need to pick up those regions and countries which have not been taken in the first round. They must come forward with a much more formidable and robust plan in the next, through the help of the Global Health Secretariat.
Thank you. Thanks a lot. We look forward to your leadership in the months to come, Dr. Ikram. Mike, to continue with what Dr. Ikram was saying, as you know, that the GHSA has been extended for 5 years more to 2028. What complementarities would you like to see develop or mature over this period between GHSA and the Pandemic Fund? Mike?
Yeah, I'm happy to take that question. Thank you, Mukesh. And it's my pleasure to be able to speak with everyone here on behalf of the Accountability and Results Task Force, part of GHSA. So I really hope to see in the third iteration of GHSA really a development of technical tools that can help countries implement or advance their pandemic fund proposals. I think this really leverages some of the unique strengths of the Global Health Security Agenda, specifically that it has a really large membership of countries and organizations, and it has predefined groups of technical experts from all across the world that can help supply essentially the technical resources to go along with the financial resources of the Pandemic Fund and really to make them most effective. I'll give one example of a complementarity that I think could be built in pretty quickly. Recently, the Global Health Security Agenda group discussed putting together essentially a sharing of best practices on how countries can get the most out of their joint external evaluations and states parties' annual reports. These are health security assessments that, for instance, for the SPAR, 80–90% of countries do every year. Having a great set of best practices that they can use to follow up from those assessments, best practices that they can use to pull in multi-stakeholder engagement, can really set countries up for success developing strong pandemic fund proposals. This is just one example. I think there's many different technical tools that GHSA could develop and offer to countries that could really help increase the effectiveness of proposals we see in the Pandemic Fund.
Excellent. Great segue over to you, Frank. Following up from what you just heard from Mike and earlier from Dr. Ikram, what kind of complementarities are you seeing? Do you think there is any expertise or experience that GHSA colleagues can help in promoting sustainability of the Pandemic Fund or of the projects, and vice versa? Your thoughts, please.
Thanks, Mukesh. Thanks for the opportunity, and I think this is a very important question. The Pandemic Fund has been created as with a strong, and I think Priya mentioned that sense of complementarity. So by no means it is a new institution. This is definitely an initiative and a partnership that needs to build on the strength and the opportunities provided by other groups. And and other instruments. And sometimes I regret that the Pandemic Fund has been named as a fund, because I think that profoundly it is a partnership, and we see that happening at the governing board level. We see the dialogue between sovereign donors, between co-investors, the civil society. That is happening, and we see also the group of implementing entities, those that will receive the funds from the Pandemic Fund and will channel them to the beneficiaries. We see them working together, thinking how they can build those proposals at country level and maybe a bit more challenging at regional level. So really, there's a lot of opportunities and avenues for us to continue to work together to make sure that what we've heard this morning from Senegal, Pakistan, or Thailand is really happening in most of our countries, and we gradually build those very strong proposals. Again, the amount of money in grants that the Pandemic Fund is providing is extremely small compared to the needs. We see that. So the co-investment, the co-financing will be critical, and the commitments from the countries will be essential to sustainability. So it's humbling in a way, and I think we need to continue this to grow this partnership. Thank you, Mukesh.
Thanks a lot, Frank. Dr. Ikram, in continuing to grow this partnership, what role do you see of the private sector? Because as you know, the private sector is a part of GHSA. And what role do you see of this higher level, this global partnership, if you will, in drawing upon their expertise and their resources in kind of providing support to countries that are working with the Pandemic Fund?
Right. Thank you. I think, again, the role of private sector, if we see during the COVID crisis, has been immense, starting from not only the medical or the treatment aspect, but going much beyond, whether it was vaccine procurement, production, and moving on and on, whether it was oxygen demand or supply, or talking of PPEs. I think private parties, they joined hands with the government most of the time during this crisis period. They worked together. And I think this public-private partnership model has been successful, and this needs to continue. And this is not talking in terms of my own country, but we have seen in most of the low middle income countries, this has happened actually. And we need to continue with this successful model on and on, and moving on. Their investment definitely in terms of future preparedness and response, because so many things that need to be manufactured locally, cost effectively, and then in turn, it's a favor to the government and in turn favor to the private sector as well. So they need to join hands, and talking in terms of, you see, the donors within the countries. There's a huge number of donors within the countries as well, talking of big donors like World Bank, or the grants World Bank, or other donors in the world. But at the national level, the good number of donors, they need to be communicated and brought in for the future preparedness, for the successful launching, and then future sustenance of the project. And that has been done in past, and that what I think needs to be done for the future as well.
Excellent. Mike, as Frank had said, this is a pandemic partnership, really. That's what brings all of us here together. In that spirit, as you know, the framework for measuring results, or how well GHSA is doing, or how effective the Pandemic Fund is, the basis and the format is pretty much the same. The methodology and the approach is pretty much the same. What is your suggestion of how the GHSA, the Pandemic Fund, or the Pandemic Partnership, a la mode Frank, how can these work together so that we can maximize these synergies, don't duplicate, and make it easier for countries to work with us?
Yeah, that's a great question. And I really like the suggestion of the pandemic partnership. I like that, Frank. First of all, I want to say it's obviously it's not an accident or a coincidence that the Pandemic Fund and that the Global Health Security Agenda use similar methodology. They're really both capitalizing on the tools and assessments that support the international health regulations. These tools have been developed by technical experts at WHO and experts from around the world, including from my own institution, the US CDC, and have been updated most recently to really incorporate some of the lessons learned from COVID-19 pandemic. These tools are really useful because they capture the capacity that these international experts around the world have seen are necessary and critical to respond to infectious disease outbreaks, including preventing pandemics from decades of experience. So all of that being said, because the Pandemic Fund and GHSA share this similar methodology, I think there's great potential for them to really work well together. Especially if we can capitalize on the action package working groups established through the Global Health Security Agenda. These groups of technical experts from around the world can really be a resource for countries to work with as they identify areas where they have gaps in health security capacity, using those international health regulation monitoring and evaluation framework tools. And these action package working groups can help them identify actions and activities that they can build in proposals to address these gaps. I think the other way that they can be really useful is that countries all over the world have similar gaps in capacity. And as they develop pandemic fund proposals, they're going to be developing a lot of the same things, the same training modules, the same SOPs for sample transport, the same protocols for biosafety and biosecurity. No country should have to start from scratch putting these types of resources together when there is a wealth of international expertise and examples of these. And every country has something to share in this aspect. So I think that the action package working groups can additionally serve as a resource to countries and their pandemic fund proposals by identifying strong technical resources, SOPs, and training modules that they can use to really help accelerate the implementation of the activities in their proposals. And I think WHO obviously is the owner of the IHR monitoring and evaluation framework, and experts in this area have a real role that they can play helping bridge these gaps.
Well, thanks a lot, Frank. We are taking your suggestion of a pandemic partnership very seriously, as you can see. And I am very uniquely positioned here. At the World Bank, I have 1 foot in the GHSA, plus in the action package, and 1 foot, in the pandemic fund. So I'm going to hold you up on this, Frank. I must apologize. We are running out of time, and I honestly wish we had more and more time to discuss many of these important issues. But I just want to take this occasion to thank all of you, to thank Dr. Ikram for your patience. You've been with us for both of the roundtables for the last 1 hour. Thank you for your contributions. Look forward to continuing to work with you very closely. Mike, thanks a lot. We work a lot together on many things. Frank, you owe me a cup of coffee as we discuss more of the pandemic partnership. So with that, I pass it back to Julie and to Ilya to bring this session to a close, and to thank all of the participants who have very patiently been hearing our very eminent speakers share their thoughts. So over to you, Julie, Ilya.
Thank you so much, Mukesh, and thank you for the skilled moderation. Thank you for all of the interventions by our panelists and their perspectives, as well as complementing the excellent remarks made initially by Priya. I do want to assure everyone we've captured all of the questions from the chat, and we'll be discussing how best we can share some of this information with participants, as well as the recording of the event. I appreciate your time, and I'm going to turn over to Abby Lopez Rivera to give closing remarks on behalf of the Sustainable Financing Action Package.
Thank you, Julie, and thank you so much for all our participants today, for our participants from Senegal, Pakistan, and Thailand for sharing your country's experiences in the midst of working on these proposals and coordinating all the stakeholders in your country to hopefully have very successful proposals moving forward, and for sharing your lessons and your experiences with the GHSA community. I hope that these are lessons that others can take away, and in working with their country's proposals. I'm also very thankful for the Pandemic Fund Secretariat for this very thorough presentation on the Pandemic Fund and all the resources that they shared today, and for Dr. Mukesh for doing a very excellent moderation of these sessions, and Dr. Mike Mahar for some very excellent suggestions on how the Pandemic Fund and GHSA could be collaborating together. I can't thank you all enough, and I think I'll close out as we have run out of time. Stay tuned for more, and we will be sharing the webinar on our website.
Thank you so much.
Bye-bye.